Hello everyone, and welcome to the new video. And today we will talk about centric relation. Okay, with easy explanation of the centric relation. Okay, we'll talk about centric relation without any difficulty with explanation. Okay, and we will explain the important words in centric relation. Okay, centric relation in restorative treatment, the goal is to create a closal contact in posterior teeth that stabilize the mandibular position instead of creating deflect contacts that may destabilize it. So how we explain it? We explain it in the restoration. Okay, the occlusal contacts in posterior teeth are most preferable because that they are stabilized the mandibular position. Okay, that's instead of a creative deflective contact. So contacts in posterior teeth are determined in restorative treatment. Okay, and we'll talk about that. Okay, the occlusal contact in restorative treatment, that is the big difference from the natural teeth. The natural teeth, that the contacts will be make the natural teeth more hygienic and more stabilize the denture because the structure of the natural teeth are designed to be bare stresses and forces compared to restorations. Okay, okay, okay. In restorative treatment, the occlusion should be in harmony with the optimum condyle position. Centric relation, which is an anteriorly superiorly braced position along the articular eminence of the glenoid fossa, with the articular disc interposed between the condyle and eminence. So that is a lot of uh, uh, a lot of words in these sentences. Okay, a lot of terminology. How we explain it, how we explain centric relation. Okay, so let's explain that. Okay, we explain that in this. We explain that in this image. Okay, condyle is C and the articular disc is D. Okay, and the glenoid fossa is S. So we explain that the centric relation is anterior superiorly. Okay, centric relation with which is an anterior superiorly braced position along the articular eminence of the glenoid fossa. So this is the condyle C. C is the condyle. Okay, I'll explain it again with a different color. Okay, C is the condyle. Okay, the condyle should be in the normal position. Okay, in the normal position, it should be anteriorly and superiorly. Okay, anteriorly, superiorly. Okay, with the braced of with the breast of what? With the breast of articular eminence. Where is the articular eminence? This is the articular eminence A. Okay, with the glenoid fossa. So should be braced. We can use rather than braced. We can uh, use the balancing for example. So the condyle should be anteriorly, superiorly, and braced and balancing with the articular eminence with the glenoid fossa. So the disc here, the disc number D should be interposed with the condyle. Yeah, it means the articular disc should be related with the condyle while the condyle is movement, while the condyle moving. Okay, for example, this is the condyle number C, and this is the articular disc number D. Okay, should be interposed, should be related with him, with the condyle move. Sorry, condyle D. When the condyle move on this the direction, the articular disc here should be moved in the same position of the condyle, should be related with it, with the condyle. Okay, if it's not related, if the articular disc, for example, if the articular disc is not moved, so there are a problem, that is a disease. Okay, this is disease because the condyle will be moved without articular disc, so it's a disease, and that is a lot of pain. That is disease, should be treated. Okay, we explain it again. That's the normal position. The condyle should be interposed with the articular disc. When the condyle moves, so the articular disc should move. Okay, this is the summary of centric relation. Okay, the position, this position is the most orthopedically stable position. Okay, as we explain it, and because it's a result of activated elevator muscles, it's also the most musculoskeletally stable position. Okay, this normal position, it's the most orthopedically, it's the most elevator muscle and stable position. Okay, this position of the condyles in the glenoid fossa has been discussed and debated for years. Okay, we explain the important sentences. Okay, it's used in dentistry as a repeatable reference, a position of mounting casts. Okay, in an articulator, that's the important word, important sentence. This centric relation, it's repeatable reference position in mounting casts. Okay, the term attempts to define the optimum relative position between all the anatomical components. I believe that condyle position is almost coincident with the maximum anticipation of the teeth. So the central relation is related to the maximal anticipation of the teeth. That's the important sentence. Okay, for the concept of central correlation to be meaningful, the basic anatomy of the temporomandibular joint must be understood. The bone of the glenoid fossa is thin at its most superior aspect, and it's not suited to stress bearing area. So the bone of the glenoid fossa is very thin. Okay, it's at its most superior aspect. Okay, this is very thin. We look at here. This line is very thin, so it's not bearing